It's my pleasure to introduce the Symposium on Naturalistic Paradigms for Brain Mapping, Clinical Applications in Neurology and Psychiatry. I have no disclosures. So what do we mean by naturalistic paradigms? Naturalistic paradigms employ stimuli that are rich, multimodal, and dynamic. For example, in this clip of the movie Moonlight, the scenery and music work in concert with the dialogue to convey the plot. Each element of the clip has a complex time course, and as such, the perception of the clip, that is, the understanding of the narrative, the emotional response, etc., evolve over time. The richness of the stimulus also emerges from unconstrained interactions between the individuals and with their environment. Importantly, unlike in the traditional paradigms, there is no attempt to control any of the variables. An important insight eloquently expressed by Tammy Vanderwaal and her colleagues is that naturalistic paradigms aim to evoke more naturalistic patterns of neural responses. However, they do not necessarily aim to mimic the natural world. So in this example, watching a clip of a movie lesson, of a swimming lesson, is not the same as watching or experiencing it in real life. However, the clip is expected to evoke neural responses that are more similar to those experienced in real life compared to traditional static or unimodal stimuli presented in a controlled task paradigm. Movie watching has increased in popularity since it was demonstrated by Fasson and colleagues that watching the same movie reliably elicits synchronized brain responses across viewers, including in distributed neural networks mediating high-order cognitive functions, and especially when movie scenes are more captivating and there's a structured plot. The same group later expressed that the brain has evolved to guide behavior in a multidimensional world with many interacting variables. The assumption that artificially decoupling and manipulating these variables will lead to a satisfactory understanding of the brain may be untenable. So the real question here is, why do we not always use naturalistic paradigms? Naturalistic paradigms, such as movie viewing, are also desirable for clinical neuroimaging. Compared to a paradigm with no explicit tasks, such as rest fMRI, movie watching limits mind wandering and constrains cognitive processes. Movie watching performance can be monitored via eye tracking. Compared to traditional task fMRI, movie fMRI is associated with reduced in-scanner motion. It's commonly used in developmental studies to minimize motion and anxiety in children. Perhaps most importantly, an important insight beautifully expressed by Eickhoff and colleagues is that movies have the potential to be to the brain what running on a treadmill is to the heart during a cardiac stress test. Naturalistic paradigms can be used to study brain function as it changes over time and across different contexts and levels of demand, and may reveal dysfunction that occurs in isolated circumstances. So finally, I wanted to highlight one of the significant obstacles to widely adopting naturalistic neuroimaging, and that is the lack of standardized naturalistic stimulus databases as needed for systematic studies. One issue highlighted in a review by Dupré and colleagues is the lack of open access to naturalistic stimuli and their associated neuroimaging data. But other issues that we attempted to tackle in a recent paper to be presented at ACI 2023 is that typically moment-by-moment annotations of the movie stimuli are not provided, and individual level responses to the stimuli are also not provided in typical or naturalistic stimuli databases. So in our paper, we provide moment-by-moment valence ratings from a relatively large number of raters to a number of movie clips. For example, as can be seen here, we can then plot the distribution of all valence ratings per second of the movie clip to get a sense of how its emotional tone changes over time. The solid black line represents the mean of all ratings, and the yellow, green, and purple ribbons represent the central 50%, 70%, and 90% of the ratings, respectively. These data lend themselves to studying subjectivity and emotional responses and will be made publicly and freely available. I will stop here and thank my collaborators and funding agencies. I hope that you will stop by our symposium to hear all the talks and discussions.